Hello, my name is Dave Little. I'm a physical therapist here at CPR, Center for Physical Rehabilitation. I'm also a certified hand therapist, which is a really unique specialization to our clinic in which I spend a majority of my day working with hand, wrist, elbow, shoulder, trauma, injuries, surgeries, and all aspects of rehabilitation from minor to catastrophic injuries to help them improve their capabilities to return to work, to be active at home with their family, active at school and back into sports, and improve their community integration. I have many models I use for the entire upper extremity. This is one I use quite often. It's a really unique hand model, and the hand is a very complicated system in which quite often there's specialized hand surgeons as well that are certified that will help with the complicated injuries. And this is a nice model because it goes through layers of the hand, so I can actually peel back parts of the hand to get to some of the deeper structures that get involved. So it's the patient education is a major part of what we do as a physical therapist for any and all injuries. So when a patient has a physical understanding of why they hurt, why their function is not good, it plays a big role in the patient's recovery when they understand that there's an injury, there's trauma. Our job is to make it better, and their job is to assist it with making their improvement as good as possible. As a certified hand therapist also, I'll see some pretty traumatic injuries that require major reconstructive surgeries to muscles, ligaments, tendons. This is kind of a unique splint I made a couple years ago for a mechanic that unfortunately took an X-Acto knife working and cut the back of a tendon here on the thumb called the extensor pollicis longus. It retracts up the arm. The doctor has to reattach it, and the patient cannot move that tendon for several weeks. And years ago, when I actually first saw hand patients over 40 years ago, they would do the surgery, put a patient in a cast for 6 weeks, then their function mobility was really compromised. Where now they'll do the surgery in a day or two, send them to me the same week, and this is an orthosis, we call it. That's custom fitted. It's material that we heat up, and it happens to fit my left hand, but it's really unique because it really helps to expedite the recovery of the patient and quite often minimize the amount of physical therapy needed. So with that tendon, which extends the thumb injured, the patient cannot extend the thumb after surgery. So to keep it from scarring down, this has a rubber band and a pulley here, and a patient will actively flex the thumb, and the rubber band, the dynamic tension, raises the thumb up just to cause a few millimeters of glide so the tendon does not hear down in sheaths and other pulleys that it has to run through. And the patient will quite often wear it 3 to 5 times a day, 10 to 20 minutes, gently exercising the thumb and surgical site. And then I'll have a second splint that acts as a cast that's removable. They'll wear at all times after that to protect the surgical site for 6 or 8 weeks until they can start actively moving it without damaging the surgical site. As well. And we'll progress them through some hands-on scar mobilization, stretching, teach them strength exercises, and quite often functional exercises depending on what job duties or sport that they will return to as well. Treat a lot of elbow patients real uniquely to our office. We have several therapists trained in a modality, manual therapy treatment called fascial distortion model techniques, in which we physically use our thumbs, the bridge of our thumb, to manipulate a tissue called fascia tissue that is a connective tissue throughout the entire body. And the tennis elbow and golfer's elbow, very common. Used to call them tendinitises, and the names have kind of changed over time. But it's truly a fascial distortion, and quite often in a 3 to 6 visit realm, we can moderately, if not completely, resolve their treatments with our hands-on care that we do, along with the patient education as well. So that's unique to myself as well as many therapists in our office. I see a tremendous amount of shoulder injuries, total shoulders, rotator cuff repairs, and they'll spend quite often 3 to 4 months in our office, 2 days a week. It's very extensive therapy. It's very tedious, so that's where the patient education comes into play, such as a rotator cuff repair, quite often for 8 to 12 weeks, depending on the extensiveness of the tear and the repair by the orthopedic surgeon. The patient cannot actively raise their arm up for that time frame, otherwise they will damage their surgical site. So that's that educational part that is so vital to the patient as well in our practice as physical therapists.